two different ways you can do the forward plank is with arms fully extended, okay, such as this, or on your elbows, such as this. Now, in addition to this position, you can protract your scapula or push up through your elbows. Instead of letting your chest sink, you'll push up through your elbows in this position, or similar in this position, push up through your elbows, and that helps to activate your serratus anterior muscles, which is a serious and important stabilizer for your scapula. So I would add that to your plank. Also, in addition to just holding that position, if you can do a Kegel exercise to bring in your pelvic floor muscles, and you can look up how to activate your pelvic floor muscles through a Kegel exercise. Add that to your program, and that helps induce more of the core muscles. So an adaptation to that position, if you cannot maintain or hold that position, is to go from here to placing your knees down. Simple as that. Or like this. An additional exercise for the side plank, you can come up like this. This really brings in your oblique muscles, and as well, this is one of the best exercises through studies of EMG, muscle contractility studies, that bring in your gluteus medius muscle, okay? Also an additional core muscle with your hips. Okay, right here it's working all this downward part, the muscles that are all facing downward. And you can do it on the elbow again, or with your arm out straight. This takes a little more balance. Now an adaptation to this, again, is go down on your knee in this position, or in this position. You want to make sure your body's not rotated too far forward. You want to keep your body straight. And that really, again, works your shoulder muscles. So adaptations, or if you cannot maintain the position with your knees up, it's a good way to start. Now, I always like to tell my patients, I want you to hold that position as long as you can to fatigue with proper form. If you start shaking, that's okay. Your muscles are getting fatigued, but as long as they're still contracting and holding a good contraction. But once you start sagging, if your hips start kind of coming down, then you're done. You need to stop. You need to keep that good, proper plank position, okay? But once your quality of motion fatigues, then stop. I usually have a goal for anywhere between 30 seconds to a minute would be good, and you repeat that 5 times. So give it a try, give it a shot.